Another country of concern is Japan, which, remember, is hosting the Olympics. Those games are scheduled to start in just under 2 months. But as you can see, they're in the midst of another surge, which at least equals any surge that they've had before. And the number of deaths every day at an all-time high. This is happening as it is being reported in Japan that the healthcare system is in dire warning of system collapse. There are reports of running out of beds and ventilators, and exhausted doctors again are warning of a, quote, system collapse and advise against holding the Olympics this summer. This is particularly bad in the city of Osaka, which is the second largest city in Japan. And the reason why they believe this is happening now is because it's being fueled by the variant first discovered in the UK. And this seems to be hitting young people more than the first 3 waves in Japan. And the concern there is that the medical professionals that are working in Osaka are near exhaustion. The quote from the article states, some of them are racking up 100, 150, 200 hours of overtime, and that has been going on for a year now. When on duty, they sometimes go home at 1 or 2 in the morning and go to bed only to be awakened by a phone call at 3 or 4. And as you can see, part of the issue has been that Japan has remained below average in terms of world vaccination rates at only 4.85 currently. And you may ask, why is this happening in Japan? As you can see here, Japan started vaccinating in mid-February. The question is why did they wait that long to do that? And as reported in this AP story, Japan began vaccinating healthcare workers in mid-February because of its decision prior to that to require additional vaccine clinical testing inside Japan, a decision many experts said was medically meaningless and only slowed down the inoculation process. Well, with the Olympics on the line in 2 months and an overwhelmed healthcare system in its western region, Japan is taking a definite turn in terms of its strategy. And while up to this point, the Pfizer-BioNTech vaccine was the only one that was available in Japan, as of last week, they made approvals for Moderna and AstraZeneca for emergency use and will be ramping up the immunization process. It'll be very interesting to watch how this unfolds. So this is a developing story, and we'll definitely keep an eye on this. Also in the news, the fact that Moderna will be applying for emergency use authorization for its vaccine in teenagers greater than 12 years of age. And we'll be doing a video coming up about vaccination in teens and reviewing the data.